NCIS chart. How to submit a patient directly to an MDM conference. Note, this applies to the following MDMs in GUH: combined oncology, hematology, head and neck, lymphoma, myeloma, myeloid, and lung. Other MDMs may use a different pathway and a temporary work list. They include skin, urology, prostate, endocrine, and gynae. Refer to a separate video. It is important that you use the search add case link at the top left hand corner of the screen. If you don't see it, then click the first icon on the right hand side, one person behind the other, and the link will appear. The quickest and most effective way to search for a patient is to use either their first name or their surname and their date of birth. This reduces the number of hits back substantially and speeds up the entire process. Do not use the hospital ID to search for a patient, because if the patient was first registered in another hospital, they will not show in the system and you will end up creating duplicate records. Once the two fields are completed, hit the search button. Once you have hit the search button, all records that apply will be displayed below. When you hover over the text of a record, it will be selectable and you can click on it. Okay, once you have clicked on the record, if there is an existing tumour site already listed, then select Open Case. Otherwise, if this patient has developed a new cancer at a new anatomical site, then choose New Case. Once you have chosen the correct tumour case, you can click on the Conference tab at the top of the screen and register them for a new conference discussion. It may not be their first and it may not be their last. That's where you access it. To add a new conference to the patient, this would be the third for this patient, click the Add at the top left hand corner of the screen and choose Conference. There are many fields you can complete, but four that we insist on are who was presenting the case at the meeting, which conference registry you're registering them for, so you need to choose the correct MDM as well as the correct date and time. What is the clinical question? It can be as brief or detailed as you like. And finally, what is the purpose? In this case, the purpose of this MDM discussion is confirmation of the diagnosis. Finally, once you have submitted, click Save at the bottom of the form. The conference will display a third conference. In this case, it's due on the 7th of February. So you can see this patient now has 3 conferences on their record.